Hi, my name's Stephen. AUT number is 9055883, and this is for paramedic 603. Doing the cardiac assessment. Hi, my name's Stephen. Your name is?
Mark.
Okay, Mark, what's your last name?
Boyd.
Okay, what's your date of birth?
24th, 8th, 81.
Okay. Your home address?
50A Division Street.
Thank you. I'm just going to talk to you over the next few minutes about your chest pain you've been having, and sort of talk, and then we're going to do a bit of a physical assessment on you by checking you. So I'm going to be, pushing and poking around a bit. Now, you're quite comfortable as you are?
Yes.
And you're happy for me to do this assessment?
Yes.
Okay. Now, Mark's at a 45-degree angle. So first of all, Mark, have you got any pain at the moment?
Central chest pain.
Okay. Can you put your hand on it? Just there, is it? Okay. Does your pain go anywhere at all, Mark?
Heads up in the jaw.
Okay. What does that pain feel like to you?
Sort of a heavy feeling.
Okay. And if you take a deep breath for me at the moment, does that make the pain any worse, or does it stay about the same?
About the same.
Okay. So as I'm talking to you, Mark, I'm going to talk to the camera. So I'm also going to look at differential diagnosis as we go along and looking for the determine whether this is cardiac or is it respiratory or musculoskeletal, and we'll just explain that a bit further in the process. So first of all, Mark, I'm just going to get you to have a look over there. I'm just having a look at the JVDs. They've not enlarged at all. They're not pulsating. Can I just tilt your head back this way? Thank you, Mark. Doing very well. Cool. Okay. As you see before, if you take a deep breath, it didn't change that pain at all. Okay. Did you feel any change in the quality of the pain? Did it make it sting, or is it dulled off, or?
Dulled off.
Okay. How would you describe that pain in your chest at the moment?
It's better than it was.
Okay. And how long have you had the pain?
A good couple of hours.
Okay. And I notice here, looking at the environment around me, that you're currently taking GTN, and it's still current. Okay. How often do you take the spray?
Just when I get pain.
Okay. And how many times have you tried it today?
A couple of times, 2 or 3 times.
Okay. Any effect at all to work on you? Very minimal. Okay. All right. Okay, Mark, I'm just going to check a few things out on your chair. Okay, if I push on your chest here, it's not sore?
No.
No discomfort? What about when I push there?
No.
Okay. Okay, I'll just get you to raise your arms up for me. And that doesn't make any change at all. Okay, relax yourself down. As I'm also looking at the chest, I'm looking for his overall general colour. He's a pretty good normal colour. He's not pale, he's not diaphoretic, he's not clammy. Also, when I notice on the chest, I can push in, looking at his central capillary refill, which is pretty good. Also, while I'm looking at the chest, I'm looking for any obvious scars of any previous cardiac surgery. I'm also looking possible trauma. Has he had any falls? There's no obvious bruising marks. There's chest wall movements symmetrical. Definitely no indication of any fractured ribs you want to push on it. So as I'm going down, I'm going to have a wee feel of your tummy. Okay, Mark? I'm just going to palpate around. Okay, you tell me if you feel any discomfort. No discomfort there?
No.
Okay. I'm just going to push up under your liver here, just going to be a bit of discomfort, and I'll just get to your head. And as I'm just looking to see if there's any pulsating JVDs, and as maybe you can see a nice little pulsating JVD there. It's not large, but it's definitely obvious. Cool, thank you. I'm just going to have a quick look at your arms. All right. No pain or discomfort when you're moving your arms?
No.
Okay. As I'm going down, I'm looking at the colour. I'm also looking at capillary refill and all the finger beds, and his capillary refill's come back pretty good, so he's got a good thing. Checking his pulse. Make sure the rate, rhythm, and strength. And I'll do the other arm too. Thanks, mate. So no discomfort there. Cool. Same thing. Looking at your capillary refill, which is all good. Also going to be checking pulses, both sides. They're nice and equal. So I'm determining if there's any changes, maybe a possible thing of a thoracic aneurysm. Okay. I'm just going to have a wee bit of a look at your legs there, mate. Okay. So I'm going to look for obvious colour. Is there any obvious swelling around the ankles? Any pitting edema? I'm also going to have a feel. There's not just any discomfort in your calf muscles here, mate. Cool. Also going to be looking at the limb baselines, his pedal pulses. Also looking at the capillary refill in his toes, and also checking motoring sensitive function. So you can wiggle your toes around,
Yep.
okay, and both feel the same?
Yep.
Well done. Cool. So when you're walking around, Mark, do you get short of breath more often than normal? Or?
I have been lately, yes.
What I'm going to do, I'm just going to listen to your chest and just auscultate, as been by just going to listen to your lung sounds. So I just want you to breathe in your mouth and out, okay?
Yep.
She's got a nice equal ear entry on both sides, no obvious sounds of anything. It's good vascular ear sounds. Cool, I'll just get you to sit forward a bit there, mate. Thank you. And I'm just going to do the repeat on the back. Cool. Sounds nice and clear there. Right, while I've got the back, I'm just going to refeel. It's not sore, any discomfort there, Mark?
No.
Okay, nothing there. Cool. No obvious marks, bruising, anything like that. Okay, we'll just lean back. So we're sort of eliminating the possibility of chest infection. There's no indications of any respiratory wheezes, gunky sound, ronchi. He also doesn't feel hot when I'm touching. And what I'm going to do is now I'm going to have we listen to heart sounds. So I'm going to have we listen to your heart. Okay. We're just going to have a listen to all 4 valves. Yep, and you definitely get the S1, S2, good little dump, little dump, little dump. No obvious sounds. Good. I'm just going to also have a listen for any carotid roots. So the pain sort of just come on a rest.
Yep.
Okay. You weren't doing anything at all. You had any falls at home. Okay. So we're looking at also differential diagnosis. Definitely no obvious musculoskeletal issues. Respiratory sounds good. It's got a bit of concern pain here that's going into the neck. Doesn't sort of increase or decrease when moving the arms, which is great. Zebdo's great. So there's no indication of anything like any acute pulmonary edema. Lung sounds are great. There's no fluid build-up. Definitely not a COPD patient. Also looking for PE, but in the case at the moment he's talking more retrosternal chest pain. It's radiating. We are PE billboard defined in one place. He's not short of breath. He's not using accessory muscles. Sternal notch is not indrawing. Isn't abdo's soft, non-tender. So in general terms, at this stage, Mark is what we call a status 3 patient. I need to do further examinations of a 12-lead ECG, full set of vital signs. So I need to look at blood pressures, pulse, SATs, a full 12-lead ECG to determine if there's any infarct, any changes. Also, he will need to go to hospital to determine bloods, to see if there is any myocardial ischemia or infarct developing. So for Mark, what we need to do now is basically transport him through to hospital, get him checked out, and treat accordingly. So at this moment, because he's complaining of retrosternal, down the neck, we'll give him an aspirin, treat accordingly, give him some G10, get an IV in, and some other pain relief will need to be. Okay. Now, yeah, as I say, he's a status 3 patient. If he was time critical where he's pale, diaphoretic, or showing severe changes on his ECG, I'll be classing him as a status 2. If he was really up to status 1, depending if he was having an inferior infarct or an anterior infarct, I'll be looking probably as a stat 1. But that information will need determined by doing other differential tests on you to determine those. So Mark, that's what we're going to do at the moment, just going to get you to check some other tests out and stuff. So, yeah. Okay, at the moment you're looking reasonably pretty good. All right. You got any allergies to anything, Norman?
No.
Okay. Cool, thank you.